We really want to move from that uncertainty into insight. So we're working to better understand the real world impact of advanced therapies in Wales, not using UK data, not using English data, not using American data, using Welsh data, and not just from clinical trials, what actually happens when they're being delivered to patients in routine care. And if you look at the range of advanced therapies that are currently available in the UK, CAR-T is sort of the most widely used, and it's mainly for diffuse large B-cell lymphoma. But actually, what are we comparing that to if we're going to look at a value assessment? So if we don't have that comparative baseline of what the landscape looked like before we had CAR-T, ultimately you might have amazing CAR-T data, but it can then just become an isolated data point. So we're working backwards to look at what were the treatment pathway and what were the outcomes and what were the attrition along the pathway, etc., in diffuse large B-cell lymphoma in Wales, so that we can then, once we have enough data for the CAR-Ts, we can then kind of do that value assessment. But without those building blocks, we're never going to be able to really look at the value added.